Hi, I'm Dr. John Hogg, founder of Medical Vein Clinic. Years ago, they used to treat varicose veins with vein stripping, which was a highly invasive surgical procedure with the patient under general anesthesia for hours and recovery taking up to 6 months or more. Thankfully, today we have much easier and better techniques. I'd like to share with you some of those techniques at Medical Vein Clinic. The good news today is our procedures are minimally invasive. They may take 15 minutes or so. You'll probably be here an hour. But you walk in and walk out. We don't put you to sleep, give you IV conscious sedation, so you're as alert after as you were before. We start by treating the bigger source veins, which are the ones that blow out the smaller veins. Then it's less likely for the problem veins to come back. I always say it's not like the car wash, where you come in with bugs and mud and an hour later you have a shiny car. It is a process. First of all, the insurance companies require a 3-month conservative trial period. And that's for good measure. It helps us sort out what is causing the problems and what is not, and it helps us get the best results. During a patient's first visit, we will do a history and physical, find out about their symptoms, and also examine their legs, determining if they have signs of venous disease. On a follow-up day, we will do a very extensive ultrasound examination of the legs. That way we test and see which veins are working correctly and which ones are the damaged veins. If the ultrasound examination confirms that the patient has the problem veins or varicose veins, we will start the patient on a conservative trial period of 3 months as required by insurance. During the conservative treatment period, we have 4 things that we ask the patient to do. One, very importantly, is to try the compression stockings. That helps push the stretched out valves and the bad veins back together so that they keep the blood moving up. I find that the best predictor of treatment results that one might obtain is if the patient wears the stockings all day long except during sleep for 7 days in a row. For instance, if the patient's symptoms temporarily improve or go away, that tells me that the varicose veins are the cause and can be treated. And if the patient comes back to me after wearing their compression stockings for some time and they say, "Doc, my knee still hurts and nothing else has changed," I say, "That sounds like that's a bone problem. Let's see if we can't get you over to an orthopedist to help you." And in summary, the 4 things during the conservative trial period for 3 months: 1, compression therapy. Those are your stockings, wearing those to keep the valves back together so the blood moves to the heart. Number 2, that's the pump. You got to pump it back. Move your legs, particularly your calves, throughout the day. Number 3, elevation. If you can get your feet above your heart, helps drain the old blood out and gets fresh blood in there with oxygen. And last, if you had a lot of pain and inflammation, try analgesics. We have about a half a dozen different techniques to treat the veins, depending on size, location, curvature, many factors, and based upon those, we will pick the one that is best for that patient. The first I'll talk about is radiofrequency ablation, or RFA. It's the gold standard and considered the best treatment for varicose veins. It is minimally invasive and covered by insurance. With this procedure, we use a local numbing medication at the site of the diseased vein. Then, using ultrasound guidance, we insert the catheter in the lower leg and move it upwards to the start of the bad vein. This RFA catheter treatment uses heat, which the patient does not feel, to make the inside of the bad vein walls sticky. Then when we pull on the stocking, the walls begin to stick together and close. After the vein closes, the blood will flow through the healthy veins back to the heart. After the procedure, we have the patient follow 3 things for 3 weeks. Patients will need to wear compression stockings for 21 days and walk a total of 10 or 15 minutes every hour that they're awake. This prevents blood clots from forming and helps generate new, good veins in their legs. And they're running, straining, lifting anything over 25 pounds, and no kickboxing for 3 weeks. The second procedure is called venous seal. It's a newer procedure and is good for patients who cannot pull on their compression stockings. Like the first treatment, a catheter is inserted into the bad veins, but instead of cauterizing the diseased veins shut, a superglue type material is used to close them. Since some people can be allergic to glue or adhesives, we are careful to screen our patients first beforehand. An advantage to venous seal is that patients do not have to wear compression stockings afterwards, and they can resume normal activities right away. Venocil is covered by Medicare and some insurance companies, and if not, we offer payment plans. If you're ready for your legs to feel and look better, give us a call at Medical Vein Clinic. That's 210-622-8000, and we'll set you up with a free screening. We look forward to helping you.
Esperamos oírte ustedes.